The breakage of a silicone implant is an interesting thing. Interesting in that when a saline implant breaks, it deflates and it's obvious. When a silicone implant breaks, usually with the way the implants are made today, the silicone still stays within the capsule, within the membrane your body has made around the implant. So there's not an appreciable change in the size. The actual volume stays pretty much the same. The breast doesn't shrink. I get calls all the time from people who think their breast is shrinking and whether their implant's breaking. A breast is not going to shrink with a broken silicone implant. It will, however, perhaps change in its look or feel. In other words, the appearance may change. It may suddenly get softer. Sometimes it can even get harder. But what patients will say is that something felt very different of the breast all of a sudden. Other patients, though, have what we call silent rupture. And what silent rupture means is it's silent, it's broken, but we don't know it. You see, the body makes this membrane, and then there's this really thick silicone gel in a bag. And so if the bag tears and the gel comes out, but is still within this capsule, you may not know the difference. Now, there are some people out there who think that any ruptured implant like that necessitates an immediate surgery. And the reason is they say it's broken, it's not doing its job as it was planned to do, the implant is not functioning in the way for which it was designed. We don't really know what the effects are of having a broken silicone implant in the body, so though it's not an emergency like we have to do it tomorrow, it's the kind of thing that we should deal with soon. There are other people who say, there's really no evidence that silicone is harmful at all. It's in all kinds of things that go in our body. It's in IV needles, it's on pacemakers. We ingest it in certain antacids, it's in food. So much is made about silicone that's really nothing to worry about. So if you like the way it looks and it feels, then just leave it alone and it's nothing to worry about. So different doctors will give you different opinions, but the general recommendation is that if a silicone implant is broken, that you should, not as an emergency, but when you're able to do it, that implant should be removed and a new implant replaced. The other issue is whether to replace the implant on the other side for the same reasons that if the one on the right broke, does that mean the left is susceptible to break soon? And I think the answer to that depends how long the implant's been in. If it's been a year or two, you may not deal with the other implant if all is otherwise well. But if it's already been a great number of years, then you could say, well, it's been 10, 11, 12 years. If the right's broken now, then maybe the left is getting close to failing, and so it may make sense to operate on that side too. So it needs to be individualized for each patient, but these are the basic issues with regards to silicone rupture.